Hello and good evening, everyone. Welcome to the 100th Blades Virtual Seminar. Blades Virtual Seminar is a platform that allows healthcare professionals to discuss current management updates of different health-related topics for better patient care. So, in mark of the 100th Blue Hills Virtual Seminar, today's webinar is sponsored by Yeni Health. Yeni Health is a female technology company, a pioneering organization focused on women's sexual and reproductive health. Yeni Health is committed to improving healthcare services across Ethiopia through advocacy, education, and e-pharmacy services. So this seminar is brought to you by Yeni Health in collaboration with Blue Hills Ethiopia. Blue Hills Ethiopia, the medical consultancy company founded by medical doctors and a computer engineer, and we aim to be an influential healthcare leader in creating a skilled community through easily accessible knowledge and preventive medicine. And I'm your host, Dr. Iheno Taddala, a general physician and first aid trainer from Blue Hills Ethiopia. Today, it's a pleasure having Dr. Abel Mestie here with us to have a presentation on the basics of digital health. Dr. Abel Mestie Makonnen is a seasoned professional in the field of digital health, boasting a diverse range of experiences. He is the project manager for the Ethiopian National EMR Implementation Project at Digital Health Activity USAID and has led the technical team to success. Dr. Abel is also the founder of Digital Health Digest, a newsletter with over 4,500 subscribers, exploring the latest trends in digital health, a platform dedicated to delivering the latest news, research, and insights in the field of digital health. So currently, Abel serves as the Chief Program Officer at Mobi Health International. Before these roles, Dr. Abel has held positions in the healthcare sector. He was an EVC project lead at Jinka General Hospital, a medical doctor and medical director at Koibe Primary Hospital. He also served as a consultant for the Generation Equality Forum and as an advocacy and graphic designer director at IYAF. In 2018, Dr. Abel co-founded the Hakim Healthcare Technologies. He is also the digital health project manager at Orbitals and a founder of Social Duty Alliance. So, Dr. Abel, the stage is all yours. You can begin.
Thank you very much. Sorry for my voice. I'm a bit under the weather with the flu. So today, first of all, thank you very much for having me here, and also for the participants for joining this engaging session. Hopefully, we'll try to discuss about the basics of digital health, and also the key components and how we can leverage the current digital health ecosystem to our advantage as well. So I'll try to cover mostly about the digital health ecosystem and the key components associated with it. So, as you know, digital health is revolutionized the healthcare landscape. So, currently it's integrating technology into medical practices. So, this is currently enhancing and supporting the patient care and improving health outcomes. So, as you can see here, what is digital health? So, digital health currently is becoming a buzzword. So the real definition and the comprehensive explanation of digital health is a bit different from journals to journals, from books to books, but usually digital health refers to the use of information and communication technologies in healthcare to manage illness, promote wellness, and also improve access to healthcare. It actually encompasses, as you can see here, a wide range of tools and services. So you are familiar, I hope you're familiar with most of the key components or the services. So as you can see, we have telehealth and telemedicine here. We have the mobile or mHealth here. So let me give you just a brief description of the key components or the services. So for telemedicine and telehealth, it's usually associated with remote consultations through video or phone calls. So currently it's getting a good momentum, usually, actually, especially after the COVID-19. So after that, the telemedicine or telehealth practice and service, they have gotten a lot of attention and investment. Currently, a lot of startups and companies are working on that. The other one is M-Health, or what we call mobile health. It's related, or it's associated to the mobile phones usually. Initially, before a few years, so it was started with SMS or USSD. Usually, we still use them in the peripheral part of many countries, usually in Africa. So they're usually used for health tracking, as health tracking apps for monitoring physical activity, nutrition, and overall wellness. But if I'm not mistaken, in Kenya and Uganda, they are still currently using the USSD or SMS feature to have these reminders for antenatal care, for maternal care, and also for immunization and vaccination reminders. Usually they are implemented in collaboration with different donor partners, and usually it's provided to health extension workers in different parts of the world. The other one is wearable devices. They look and feel like expensive gadgets, but usually they are currently used to track and monitor different aspects of our vital signs, like heart rate, pulse rate, heart rate, BP, saturation, and also sleep patterns and steps as well. So they are actually related to monitoring and tracking individuals' health status. Usually, they are usually associated with Apple Watch, smart Samsung smart Fitbits, and others. So they actually have the potential to track one's or individuals' health data and information. The other one is electronic health record. This one is the famous one. Currently, we are implementing in different health facilities with the support from the USAID. Currently, the Ministry of Health is deploying electronic medical record system in different parts of the cities, majorly tertiary hospitals and general hospitals. We have been supporting this project, the national EMR implementation, which is based on the BAMNI open source EMR. And currently, we are going for the EHR, which is more of a centralized digital health records that store patient information, medical history, treatment plan, investigations, and everything. The fifth one is health information exchange. These are more of platforms. They are not products, but this platform, they allow secure sharing of patient data across different platforms. Usually in our country, usually in Addis Ababa, the issue is we have different siloed EMR and different patient tracking applications here and there, usually developed by the private sector and also the donor partners, but they are not integrated or interoperable. And this will be a huge challenge and problem when trying to access a single patient's information within different health organizations. So the government currently, the Ministry of Health, is working on how to integrate different platforms into one. And currently there is a standard for the EHR, which specifically puts and focus on the interoperability and integration platform. The sixth one is the recent one, which is gaining momentum for the past 2 or 3 years, artificial intelligence and machine learning. Now everything is related to AI. AI-driven diagnostic tools are currently being implemented. For example, in different countries, usually in US and Europe, they are currently using AI and machine learning to provide clinical decision support and integrate it with their EHR, so that whenever there is any contraindication with medications, any issues related to patient's information, then this AI can trace and recommend and alert the physician or the nurse. The other one is digital therapeutics. This is a new term. It's still in developing stage. It's more of evidence-based software solutions designed to treat or manage specific disorders. There are different literatures which are currently focusing on this, and most experts believe that this will help in alleviating and mitigating challenges related to medication therapy. The other one is patient portals. These are usually, we call them as PHR or personal health records. They are more of online platforms where patients can access their health information, even scheduling these appointments, and communicate with their physicians and healthcare providers. So this is currently being implemented in different parts of the world. Actually, it was the personal health record or portal started years back in 1980s, 90s, but it was still in development stage. No one knew how to navigate except for few experts and few organizations. But currently, even in Ethiopia, I have seen some experts working on that, and there is some development during this the current fiscal year. The other one is remote patient monitoring or RPM. These are technologies that allow healthcare providers to monitor patients' health data remotely, facilitating timely interventions. These are actually related, even they are related to the wearable device. Let me give you an example. So a few years ago, I think it was 2 years back, there was a case in US. So this guy had a follow-up, cardiac follow-up with his specialist in certain city. So his Fitbit or his wearable device was connected to the EHR within the facility. So one night, while he was sleeping, there was an abnormal rhythm of the heart, and the Fitbit actually traced and alerted, and the information was sent straight to the EHR, which the EHR informed the physician. So the facility or the physician was able to send an ambulance to that exact location, and they were able to save that guy. There was also another incident in Sweden. I tried to cover it in my newsletter few months back. The last one is chatbots and virtual assistants. They are more of automated systems that provide immediate response to common health-related queries or questions or issues. Currently, these companies are working on developing different chatbots using AI and also machine integration. And what they're currently doing is, rather than going to the physician for the visit, they screen them using these chatbots and virtual assistants, which help them in minimizing the huge flow of patients. Okay, so let's talk about the history of digital health. It was started years and years ago, but currently it's gaining momentum, it's getting the right amount of attention. Now people are learning, studying about it, writing about it, and governments are, most of the governments currently are investing on it. So as you can see, the early beginnings start during the 1960s to the 1970s. So in 1960, the first introduction of computerized patient record system was started. So during the 1960s, the first computerized patient record system was introduced. I think it was in US in Mayo Clinic. I think, yeah, if I'm not mistaken, it was in 1960 in Mayo. They tested it and it was a success. And in 1970, the development of the first health information system, or HIS, was developed primarily for research and administrative purposes. Then in 1980s, it was more of era of growth and expansion, where in 1980s, to be specific, the first telemedicine programs were established. They enabled the remote consultation, and there was an initial test, and it was a success, and they continued refining and optimizing it. So the next few years, I think it was in 1989, the introduction of personal health records begin to gain traction or momentum. So initially there were some efforts in developing personal health records, but it was during the 1980s that it got the right amount of attention and traction, which led to better investment and development of additional features. During the 1990s, as you know, it's more of internet era. So during that timeline, there was a new development which was called the Health Insurance Portability and Accountability Act, or which we usually hear about HIPAA Act. It was enacted in the US, and this was a turning point because they were able to establish standards for electronic health information. So this was in 1996, and after that they were able to develop different features, different workflows for electronic health information. Before that, there were no any standards, and it was difficult to have a workaround on how an EHR or an electronic health record system should be. Then in 1999, the Institute of Medicine published a book. I think it was To Err is Human, that humans do mistakes, or it was used to highlight the need for IT to improve patient safety, because there were some issues to this malpractice related to physician error, different issues related to human error during patient visits. So they published this book to highlight that by implementing different IT solutions or IT system, then we can improve the patient safety and also provide better care for patients. So the next phase was the 2000, early 2000, and it was more technological advancements were advancing well, and also there was a huge investment on that. In 2004, the US government launched the first of its kind, the Office of National Coordinator for Health Information Technology. So this helped in supporting such ideas, such innovations, and implementation of different health facilities. In 2009, the Health Information Technology for Economic and Clinical Health, or HITECH Act, was introduced, which promoted the adoption of electronic health records. The 2010 up to 2020, there was rapid adoption of such innovations, digital health innovation. In 2011, the introduction of mobile health app, they began to support this patient engagement and support. In 2016, patients access, in 2016, it was the time where patients were actually able to access their full medical records online. Usually, initially it was started empowerment and better care. In 2018, the National Health Service aimed for paperless operation in UK in most settings, with patients being able to view all interactions of their visits online. In 2020 and up to now, up to date, it's called the current trends and future direction. More digital health became actually critical during the COVID-19, as you remember. There were a lot of adoption of digital health solutions like telemedicine, trackers, reporting system, and which accelerated the innovation ecosystem. So all these accelerated usually the telehealth adoption globally, and I'll discuss later how telehealth is still making a huge impact on the digital health ecosystem. In 2022, the national interoperability standards are adopted across healthcare systems in various countries. I will not be speaking about the interoperability standards. We have different FHIR, OpenHIM, OpenHI. We will discuss it in another time. And currently, AI is the trend. So let's look at the market share, the market size, the trends. So globally, currently, it's estimated that the healthcare markets, the digital health market is projected to grow from 180 billion in 2023 to 549 billion by 2028. Which is not our topic here. So this growth is driven by the increasing demand for remote healthcare solutions and advancements in technology. And about 40 to 50% of this growth is usually due to the telehealth, telemedicine solutions. And it's currently projected in 2031 to be $836 billion. So this is a global market size. Let's see Africa. So the growth of African digital health market, as you can see in 2020, the current one is, the market is valued at 3.8 billion, still low compared to the global one. And in 2030, it's actually projected to $16.6 billion. As I mentioned earlier, about 43.2% of this market of the 3.8 billion is due to the increase of the telehealth, telemedicine need. Usually it's actually due to the COVID-19 and additional investments being made by donor partners. Okay, let's see about Ethiopia. So I was not able to find the market share within our country, but I can discuss, or I can tell you about the current strategy by the Ministry of Health, Ethiopia. So the current digital strategy is to have two things. So it focuses on the digital identification systems and infrastructure development. So the ministry has initiated digital identification programs to enhance healthcare access and delivery efficiency. These systems, actually, the digital identification, they aim to connect patient information across various facilities. So this enable better management of chronic conditions like diabetes, HIV, and other chronic illness. And the other one is infrastructure development. As part of the strategy, Ethiopia is currently implementing a hub and spoke model. So this model will have 7 data centers serving central hubs for health facilities nationwide. It will be set up in different regions of the country. This will help in securing data sharing and secure data retrieval from those different facilities, different healthcare facilities. We have different challenges with this implementation and other as well, but I'll discuss it later on. Okay, so what are the benefits of digital health? We have discussed what it meant. We have discussed the history and market and revenue. So why are we using digital health? Personally, I believe that in order to achieve the universal health coverage, it's my opinion, but I firmly believe that without digital health, it's difficult to achieve universal health coverage because the different countries have tried it and still we are not there. We have different initiatives, the 2030 agenda, the 2025, if I'm not mistaken. So without the implementation of and support of digital health, it will be difficult to achieve universal health coverage. So the first benefits of digital health is it provides improved access. So what do we mean? This means digital health can facilitate healthcare delivery to remote or underserved population, usually by utilizing technologies like telemedicine and telehealth. The other one is enhanced patient engagement. So digital health solutions, they have the ability to empower patients to access to their health data and personalized care plans. So this will, if a patient has an access to his individual medical record information, treatment plan, investigation information, then the patient will be empowered. That means they can decide on their treatment. They can decide on how to move forward with the treatment. So this will help the patient to have a better engagement, which we currently are working on. The other one is the cost efficiency. So implementing any EMR or HR will help in reducing the cost associated to these paper-based printouts and additional costs related to that. These solutions can also reduce operational costs by streamlining workflows, process, and minimizing these hospital visits. So any patient who have access to his medical record information, then they can actually they can actually create appointments while while being at their comfort of okay, they can actually create different appointments while sitting at home, and it will help them to reduce unnecessary travels and unnecessary visits to different health organizations, hospitals. The other one is better health outcome. So personalized treatment plans based on real-time data can lead to improved patient outcomes. So this will help decrease patients' unnecessary visits, unnecessary treatment, unnecessary investigations. The last one is data-driven insights. These are related to analytics that can identify trends in patient care. Even such kind of information and data can lead to more effective interventions. So what are the challenges in implementing such digital health solution? The first one is regulatory hurdles. This means the regulatory hurdles, they are related to governance and leadership. Most of the time, governments, different Ministry of Health within different countries, they don't have these standards, policies when it comes to implementing such solutions. So this makes it very difficult for anyone who wants to implement such solution, hoping to navigate the digital health ecosystem and support the community. So usually navigating the complex landscape of such regulations can be challenging for digital health innovation. So because of this, most of the time, even NGOs, startups, they usually are not successful in finalizing, completing, and being successful in implementing different solutions, be it EMR, telemedicine, and others. So if we have the right regulatory documents, regulatory policies and standards, then it will be, for example, let me give you one. Usually, when it comes to standards, the US and Europe, they have a good standard. For example, for personal data protection, they have a policy called, the act called HIPAA for UK, for US, and GDPR for the European countries. But in our country, the legislation, or what we call, it's not an act, but proclamation, stating about the personal data protection. It was published this year in July. I think it was in July 2024. But before that, it was difficult to know and implement measures related to privacy. The other one is technology adoption. This is one of the major issues. So let me give you my experience with the EMR implementation project. The major issue were three, actually. The first one was leadership attitude. The second one, infrastructure. And the third one was attitude by the healthcare professional or end users. There was a term called resistance to change. So this resistance from healthcare providers was due to unfamiliarity with the new technologies, and this actually hindered the implementation process. So what we did was we had to provide repeated and informative And we also added some gamification to the training of the different modules related to the EMR. So we started from how to navigate, how to create accounts, how to log in, how to order medication, how to start a visit, how to register any patients. The list goes on. But it was after a repeated capacity building session that we understood some of the issues. And one of them was related to most of the professional or the staff, they were not good with typing. So we have to come up a software and we installed in their on their PC so that they can play with it. It has some part of gamification aspects. So they were able to learn through time how to type and everything. And this actually helped in bringing these people on board. And we have provided different sessions for, even we categorized the level of training for end user, for technical like system administration, and the other one was related to troubleshooting. So before going for the deployment and implementation of solutions, we need to understand what who our audience are. We need to understand that, because if we can understand and mitigate any issues related to that, then the technology adoption or this implementation will be as smooth as possible. The other one is privacy concern. When we say about privacy concerns, currently it's becoming an issue that such digital health solutions, they must ensure the security of sensitive patient information, because this is huge and paramount. In UK, the National Health Service, there was a report about an incident, and hackers were able to get a lot of patient information, and they actually locked one of the EMR HR, which had a lot of organization, a lot of hospitals within it, and they lost a lot of million in pounds. It was a huge loss for the government. And patients, the major issue is patients' information. They are confidential and they are valuable. So if I have information about a particular person, if I have his health information, it will be easier for me to track down that person and do harm or compromise everything. And usually health insurance companies, it's reported that they buy such information about a couple of patients, thousands of patients, because that will help them to categorize and increase the amount of insurance. So if a patient, if they have information that a single client has diabetes, hypertension, so what they will do is they will increase the amount of the insurance. They will label it as a premium without the knowledge of the patient. So such kind of informations, they are important and they should be kept securely. The other one is interoperability issues. I have mentioned earlier that one of the major issues that we are having scattered, siloed information about a single patient or communities. They are not integrated. They don't talk to each other. We have so many EMR in this area. We have the Prime Care, Pulsetech, Orbits, Medax. I can name them. We have a lot of AMR, but they don't, talk to each other. They are not integrated. They are not interoperable. So this creates, rather than reducing the cost of a patient visit, it will actually usually increase. Let's see some of the root cause, the root issues within our continent. So the first one is lack of infrastructure. As you can see here, most of the digital health implementation within our continent, Africa, is supported by donor partners like USAID, CHAI, BMGF, and other organizations. This is because African governments, they usually don't have the budget, or they don't give a priority to such infrastructure issues. So usually it's expected from donors to provide those materials, the server, computer, network infrastructure, cloud, and everything. So it is a trend that some part of the region here in Africa, they are actually providing more investment in budget on this infrastructure. The other one is digital literacy. As you know, we have a lower level of digital literacy when it comes to technology and healthcare. So because of this, we are facing issues related to such digital health solutions implementation and adoption. The other one is regulatory barriers. So usually regulatory standards, they are in support of such implementations. But in our continent, due to unavailability and low understanding of such standards, then they are now barriers or challenges of implementing different solutions. And usually the issue is they will be implemented. For example, we had smart care EMR, which was implemented about 11 years back with support from a university, Tulane University, if I'm not mistaken. But the issue was there were no any standards, and a few number of experts they got together and developed some standard while implementing that EMR, but it was not sustainable. So after 10 years, 11 years of implementation, then it was stopped. But currently, now we have our own digital health blueprint, we have the HR standard, we have the personal data protection, and the new standards related to interoperability standards are also being published. So I hope we'll have those issues mitigated. The other one is insufficient funding. The insufficient funding from government and other stakeholders, they are one of the challenges in limiting the technology or implementation. So we have discussed all about, I have discussed a brief about digital health. So if you are interested and if you want to work on digital health and if you want to pursue in this ecosystem, then these are some of the recommendations for anyone who is interested. The first one is educational opportunities. You can get degrees in healthcare information, and currently there are universities providing masters in digital health, and you can I'll try to share some of them after the training, after this webinar. So there are different opportunities when it comes to having digital health specialized training. So usually, initially it was started in German, but currently UK and US, they are working on providing such opening such departments and providing partial and full scholarship. Usually in Germany, it's more of a full scholarship. You can have the masters in digital health within just a year and a half. The other one is online courses. I have been sharing this quite for a while now. We have different online resources. For example, Coursera is the best platform. I have actually taken some courses on Coursera with financial aid. You don't have to pay anything. You just have to apply for financial aid, and still you can get the full courses. We have specialized and separated courses as well. So some of the courses are provided by John Hopkins, some are by London College. The other one is networking in professional development. This has actually helped me a lot. I usually network in events and also usually on LinkedIn. So this has been a good source of new knowledge and skills and new view or outlook on digital health. So I would suggest if you can be active, refine, optimize your LinkedIn profile, reach out to people whom you think are experts in digital health. There are a lot of articles about digital health, specifically about EHR, telehealth, telemedicine, AI, and everything, including my article as well. So you can subscribe, you can share, you can actually interact. The other one is by staying informed with research and publications. There is a research journal like PubMed, which is specific to digital health. I have already shared this one on the LinkedIn on LinkedIn as well. And there are a lot of research and publications related to different aspects of digital health. The other one is practical experience. I would suggest you do internships in different companies. Currently, there are a lot of internship positions in different startups who are implementing telemedicine, EMR, and other solutions. So you can have a practical experience. You can have a good amount of skill and knowledge from the process. So I would suggest I will be sharing some opportunities as well. The last one is so through all this process, I would suggest you develop skills. So what are these skills? These skills are related to health informatics, health data analysis and interpretation, and also last but not least, knowledge of regulatory and ethical considerations. So we have different standards when it comes to implementing such solutions, and I suggest you have the right skill for the right position. So these are some of, I think my screen is visible. So as you can see, these are some of free courses related to digital health. They are available online. You can check them. We have, for example, I can show you some of them. You can take this course, Ethics and Governance of Artificial Intelligence for Health, which is provided by WHO World Health Organization, Applied Digital Health Ethics by Digital Medicine Society. You can take courses, Introduction to Digital Health. This will help you in having a basic understanding of digital health. This is provided by Imperial College of London. You can take courses related to accessibility and inclusion in digital health, digital collaboration systems in healthcare, health information technology fundamentals, using electronic health records. I have shared all these links on LinkedIn. You can check them out. The other one is, this is our newsletter, the Digital Health Digest. So we try to publish articles about different aspects of digital health, which is a weekly, currently the weekly program or schedule is a bit difficult. So we are doing in a monthly and bi-weekly publications. Other than that, we also provide insights into new updates, new knowledge, inventions about digital health. So you can check the newsletter on LinkedIn and subscribe. So this is all about the basics of digital health. Thank you again for the opportunity to present this slide. So if you want to get in contact, here is my contact information. We can connect on LinkedIn. This is my email. So I think if you have any questions, suggestions, you are welcome. And thank you very much. Over to you, Doc.
All right. Thank you very much. So yeah, we can proceed. It was a very nice presentation. So yeah, we can proceed to the question and suggestion sections. So participants, if you have any questions related to digital health, please write it in the chat box so Dr. Abel can address them.
Okay, thank you, Dr. Yena. So I can see we have some. Okay, there is, I think it's more of, a suggestion in the comments. It's from Tagain Bugdada. It says there is also a gap in our curriculum to include courses that taught this. Your update is crucial. Okay, how about the literacy level of patients for having communication? Okay, thank you. This is the right question. We have been asking this while implementing different solutions. There is a huge gap when it comes to knowledge and the teaching. We have been suggesting this and even proposed the Ministry of Health to incorporate digital health courses within the curriculum, because if the major issue is resistance, the major issue is which is one of the three, is related to resistance genes by health professionals, and this one is due to low literacy rates when it comes to digital health solutions. So if it is part of the curriculum, and if we can understand it and get used to such ecosystem and science, it would be easier for us when the time comes for implementation and introducing such informations. When it comes to patients, it's something else, because we are not there yet, let alone the patients. We are not even providing the right amount of training and capacity building to health professionals. So once we are done with that, we can actually go to patients, and these healthcare professionals, our end users, they can provide those trainings, they can show them, they can actually interact in a better way. That currently the ministry is actually working on providing such capacity building programs within the coming new project with support from the USAID. I think it was 2 months back, me and a professor from Labrock University, we provided healthcare digitalization impact training in different hospitals. I think about 16, 18 hospitals within the city. And the data we found was shocking, because initially 3 years back, we did the research on the literacy, the skill, and acceptance or adoption of such digital solutions. And the outcome or the report generated was not a good one. So we had to come up with ideas, solutions on how to mitigate such issues. So we were able to provide training for about 208, 211 healthcare professionals within just within just about a week. So we advocate for advocacy of digital health. We're not there yet, but we are advocating. So it's been good. It's been there has been a progress when it comes to advocacy and acceptance of the digital health ecosystem. So we'll work on that, and such trainings are actually part of the process. And I hope that covered your answer. Thank you. Covered your question, sorry about okay. Okay, the other one is from Bethlehem Abdu. The online course you took where, and the link, please. Okay, yeah. What I'll do is, okay, let me share the links here. They have, okay, okay. I have already shared them on LinkedIn, but what I will do is I'll put the link here on the chat box. In the meantime, if there are any questions, Dr. Rehino, you can continue.
So the other question is, what is the requirement to start telemedicine as a business in Ethiopia by Ministry of Health and other institutions? This is a question by Muaz.
Okay, to tell you the truth, there is a department within the Ministry of Health called, I think, Health Information Corner. Actually, the standard is that it's not yet published regarding to starting telemedicine or telehealth company. But the ministry is working on a standard. I'm not sure when it will be published, but they are working on that. In the meantime, there are just few requirements which is set by the Ministry of Health. There is a department for such process. Maybe I'll try to share that later on if I have that link working. So it's not a standard. There is no standard, but there is a process where you can go and show your prototype or your plan to this department, Innovation Corner for Health. They can give you more information on that. Other than that, I'm not aware of any standard when it comes to telemedicine, telehealth. But if you are planning to start, just let me know. I can help you out in starting up because I'm currently leading the team in Nigeria for the telemedicine implementation, and we have been quite successful on that. So I can guide you if you need my help. Next question, Dr.
All right.
Rena.
Thank you very much, Doc. So the next question is by Muhammad Said, and he said, would you tell us from your experience about the ethical issues and research related to mHealth and telehealth?
Okay. So for the telemedicine, I can vote for that, but for the mHealth, I'm not sure about that. But for the telemedicine, we had, you see, I have mentioned this. We don't have that standard or policy in place in different countries. For example, in Nigeria, while we are implementing, we are still working on another version. The previous version is still being utilized by the health professionals and patients. The ethical issue is our platform it's developed in accord to the HIPAA and the Nigerian data protection rule, NDPR. So we developed the platform based on those standards that helped us in minimizing such ethical issues. But there are some reports that there were some information leaks and patient information being sold to other stakeholders without the patient's knowledge, and this all violates the patient privacy and confidentiality rule. Usually these are the kids. Other than that, currently even AI is being implemented before meeting your physician or your service provider. You will need to fill out some information about your health. So after that, the platform will categorize and link you with the right specialist, the right personnel. But sometimes this will be overutilized and there will be some ethical issues, and such informations will be compromised. And these are some of the issues I was able to. Other than that, if it is covered by such standards, then such issues wouldn't be challenged. Thank you.
Yeah, thanks very much, Doc. And so the next question is by Fanuel. So what is the status of EMR in Ethiopia? For example, Smart Care was launched 10 years back. Where was it launched and how far did it cover? Also, what about the current EMR usage strategy in Ethiopia? For example, Ministry of Health has started launching them in health centers. Do you have any insights in regards to this?
Okay, thank you very much. Yes, so the major issue when it comes to EMR implementation or deployment in Ethiopia is they are not sustainable because the government is not taking charge of such initially, not now, but initially, previously, the government was not taking charge of such solutions or implementation. So for Smart Care, my first exposure was in 2007, while still I was in med school. So we were able to have a visit at Haidar Hospital in Mekelle, and we were able to see the integration, the modules, and it was working fine. It was wonderful, even though additional modules would be needed to incorporate the different need from the facility. And it lasted for about 10 to 11 years, but no one was able to continue with the implementation because the developers at that times and the IT team, they were not from Ethiopia, they were more from the South African company, which were contracted to deploy this. In other countries, for example, in Zambia, they are implementing it in a wide scale. Currently, they have been able to implement it in about 235, 36 health facilities. It was last year. My latest information is last year. During a summit, we were able to exchange ideas and such experience, and I was able to learn that they were able to even to implement data analytics embedded within the EHR. So they were able to continue because they had their own internal team who were able to continue the implementation. But in Ethiopia, due to the fact that there were no any experts who were able to continue with the implementation. There were some, but it was not enough. So and also and associated with the funding and everything, it was stalled, and it was actually converted to by EHR, another EHR, but it's based on smart care, and it was being implemented in St. Peter's, and after a while it was stopped there as well. But currently, with the support from the USAID, there is a digital health activity project which started about in 2019, end of 2019, and currently the first phase has actually, I think it has already ended in September 2024. I was part of the technical team from the Orbit side. I was leading the development team. So we were able to implement the Bahami EMR. We had about 12 pilot hospitals and health centers. They were found in Addis Ababa and outside of Addis. We had Turnash Beijing General Hospital. We had Faransai, Saris, and Kasanchis Health Center, and Abel Trauma Center, and the others were out of the city. We had Laku, Butajra General Hospital, Adama Hospital Medical College, Makana Salam, University of Gondar, and the last one was, it was found in Dredara, Sabian General Hospital. So they were our pilot sites. So we were able to customize, configure, and add and develop different modules, and we were able to integrate the EMR in between from the registration room to the pharmacy and billing module, billing department. And so any patient who is visiting that specific facility, they are able to complete their treatment and everything paperless. And we successfully implemented the paperless process within these facilities. And it was tiresome and it was hard, but we are able to do that. Apart from that, we are able also to integrate it with another pharmaceutical software, and also the DHIS2 as well. So currently, the ministry is taking over, and the ministry is implementing in different facilities. So we have been providing both the training and also the technical assistance to the ministry. And currently, the ministry the ministry is implementing it in different facilities. I think this year the plan is to implement it in about 300 facilities within the country, and it's going well. And also capacity building trainings are also being provided. We develop different manuals, different documentations for the end users, for the IT team and the administration as well. So I hope this has answered the question.
Yeah, thank you very much. In fact, there are a lot of questions in the chat box as well as admiration comments and suggestions. I will be forwarding them to you, but we can raise one or two, maximum two questions because we are running a bit out of time. And we also have a few minutes of presentation from ENA Hills by Dr. Radiat. So coming to the other question by Maniang. In your experience, what are the key considerations for a practitioner when implementing telemedicine solutions, especially in rural areas?
Okay, thank you very much. So the first thing you need to understand is the community where you will be implementing the solution. Because you have to understand the environment. You have to know the infrastructure. Do you have internet? Do you have additional infrastructure related to power supply? Do you have solar power? Because usually the issue is if you don't have the right understanding of the community you will be providing or you will be implementing this telemedicine or telehealth product, it will be difficult. For example, most of our community who are living within the peripheral areas. I have been working in South Omo for about 3.5 years, and I know it's something else. I was working within a community called Mali people. I think the community population size is about 127 or 130,000 community size, but the community doesn't usually they don't know, or most of them they don't utilize mobile phones. When we are talking about this, the practical scenario, which is the truth in the ground, on the ground. So if you want to implement or telehealth service to such community, then it will be difficult. So, because forget about having a smartphone, but even having the small button mobiles, usually the language as well matters, and it's not inclusive. And usually they are part of the community within the society that have those phones, and part of the community they don't even have that. So rather than going for the mobile application or the USSD or the mHealth to provide that telehealth or teleconsultation, be it on the phone or video call, I would suggest if you can partner with different stakeholders in bringing and implementing a telemedicine kiosk or telemedicine walking clinics with different devices integrated with it. You can implement it within a health center or health post. So you will train the health extension worker or a nurse on how to utilize and how to have the consultation started for a specific patient. So, and the other thing is, this is just my opinion. So, you need to consider not only the equipment, the infrastructure, but also who is going to use that platform. And when I say that, apart from the community, you need healthcare providers. You need to get them on board. So you need to understand and you need to plan on onboarding physicians who usually because it will be difficult without them to continue or to implement such solutions. Usually the issue is with different companies the startups. They go for the funding, they get the funding, they develop the prototype and finalize the product, and they implement it or they deploy it. They deploy it. But after that, the issue is they have patients who wants to use that platform, but they don't have healthcare providers or physicians or specialists who will be giving or who will be providing those services. So you have to um, take into consideration different aspects of the ecosystem. Thank you. And I have shared you a link which will lead you to different links of specialized trainings and courses. So I will add another one later on. Thank you. Over to you.
Yeah, thank you very much, Dr. Abel. Today's audience is very engaging, and there are a lot of questions, and I wish we could have addressed all of them, but due to time constraint, I don't believe we can continue further with the questions. Yeah. So on behalf of Blue Hills Ethiopia, Yeni Hills, and all our participants, I would love to thank you for taking the time to present on a very important topic, which is digital health. And for the participants, this is not the first time that Dr. Abel is presenting on Blue Hills Ethiopia. He has previously presented on multiple seminars related to digital health. So you can access them on our YouTube channel and Blue Hills CPD website. So we will be coming back to you, Abel, but for a few minutes, we will have Dr. Radit present a bit about Yeni Hills. Dr. Radit, I don't see you.
Hello, can you hear me?
Yeah.
Okay, so hello everyone. Thank you for this great presentation and information, Dr. Abel and Dr. Johanna for organizing this. So my name is Dr. Radit Damse. I came from Yeni Health. I'm a learning and outreach lead at the Yeni Health company. So I'm just going to give you, I know it has been a long presentation, so I'm not going to take more time. I'm just going to brief you about Yeni Health and why we are doing this trainings and why is it free and why are we collaborating with this? What is Yeni Health Marketplace? So to introduce you, you can make it the next slide. So Yeni Health is a femtech company. We have an application and a website. When you download the application, we have a pregnancy tracker for women and period tracker for women. And also we have e-pharmacy where you can prescribe medication and we deliver it to your patients. And we have also, we can see on the presentation, we have 15 healthcare professionals, doctors, GPs that are women, that writes blogs and that does YouTube videos. So next slide. So it's a one-stop shop for healthcare marketplace where you can order medication, where you can get educational platforms, and also in November we'll be launching our telehealth, so that you can have a call center for your health for your patients. So to briefly introduce you about this marketplace, only basic for healthcare professionals. Can you put it on slide? Yes. So you can see here, Dr. Lydia Burkesta. So what is healthcare marketplace in Yeni Health? We have different kinds of healthcare professionals registered in our platform. So what we do is, or this project aims is, we train or upskill healthcare professionals. We have seen the gaps that we have, communication skills, leadership skills, and the technical skills like BLAs, triage, ECG. We have done this in collaboration with Blue Health, different kinds of trainings. And then we match them with job opportunities or healthcare facilities. So it's a platform where you can, where we upskill healthcare professionals and then match them with job opportunities. So as you can see this slide, we do your slides here. I hope that all of you have registered and submitted your CVs so that we rate it first. So we rate it, and as you can see, this Canva profile, we do your CVs like this, and then we upskill you. You can see the stars. Every time you get trainings through our platform, you get a star, and then we match you to job opportunities, or we send this to job faculties where we get asked a lot and provide you with job opportunities. Basically, currently we are focusing on digital health and telehealth because we're going to launch our telehealth where also you can have a job opportunity there. So it's on its pilot form. So most of the trainings that we do are for free. Thank you all for joining us. I would also like to thank again Dr. Abel for the most informative session that he has given and for his time. So that's all I have. If you have any questions, you can forward it.
Yeah, thank you very much, Dr. Radit. So participants or attendees, if you have any questions regarding Yeni Hill's platform, you can forward them or write them in the chat box, so it would be easy to address them now.
I would like to emphasize one more, if I have a chance, Dr. Ihona. So if all of you today, I hope that you have registered on the link that we provided where you submit your CVs and professional photos, because moving forward, we'll have different kinds of trainings and different kinds of job opportunities that we'll be posting. So it's really mandatory that you register there and submit your CV so that we can build it for you and give you the platform for you can find part-time jobs, online jobs, and different on telehealth and different kind of the marketplace on the healthcare sector.
So one question is, any expertise Yeni Health including related with pharmacy professionals?
Yes, if you have joined our Telegram channel, Healthcare Marketplace for pharmacists, we have currently posted a job vacancy for pharmacists. Basically, it's for pharmacists only. We have different kinds of platforms, and we recruit all types of healthcare professionals.
So yeah, so the other is, do you have training? Yeah, she already mentioned it, but do you have trainings? Do you provide certificates?
Yeah, we collaborate with different training companies, like for example Blue Health, and we provide the certificates like for the training that we have conducted and sponsored today. So of course we do. So mostly our CPD points and the different certificates. Currently, we're not providing any degree type of trainings. Do Yeni Health has pharmacists including in the team? Yes, of course, we have almost 3 pharmacists in our team. Okay, are the training provided online? It's also in person and online. Since we have been requested more online because we have conducted in-person trainings, now we're focusing on online trainings, but also we conduct trainings in person like BLS and triage and ECG. We'll try our best. Can Yeni Health support health informatics? Yes, of course we do.
Yeah. So
okay.
Thank you very much, Dr. Radit. So, they have any questions? If you can, could you please put a contact email or contact phone number of Yeni Health in the chat box? All right. So back to you, Dr. Abel. Again, thank you very much for an amazing presentation. Yeah, sorry, Doc.
Okay, I was just saying, thank you very much for having me here to share my experience in work, and also for the audience for the amazing turnout and for the amazing comments and questions. It was engaging. Thank you very much, everyone. And please let's connect on LinkedIn. You can contact me on LinkedIn, over the phone, or my email as well, which I have shared earlier. So if you are passionate about digital health, just hit me up and we'll discuss more. Thank you very much.